morning to all my dear listener and wish you all Happy New Year in 2021. So, I am Rajasree. In today, the topic of my presentation is sense and sense of taste. So, today I am going to talk to you about sense and sense of taste. First of all, definition of sense. Sense is the parameter of our body in which receives external stimulation in the form of taste, smell, touch, and hearing. In the other way, it is defined as a way that the body feeling out something. Example: feeling, tasting, touching, and seeing. There are 6 senses. They are of ear, eye, nose, tongue, skin, and equilibrium. In today, I will discuss about taste and tongue. First of all, gustation. Gustation, the action of tasting. So, gustation is the sensation of taste resulting from the action of chemical on the taste buds. So, let's we move on to tongue. So, what is tongue? It is a muscular, boneless, highly movable organ, and the upper surface of the tongue bear a number of small projections that is known as papilla, and these papilla contain taste buds. Papilla are of 3 types. They are fungiform papilla, filiform papilla, and circumvallent papilla. The fungiform papilla present at the tip of the tongue, and the filiform papilla near the center and the side of the tongue, and it is the smallest papilla. So, filiform papilla is the smallest papilla. Then the circumvallent papilla present at the base of tongue, and it is the large papilla. So, circumvallent papilla is the large papilla. Then the function of tongue. Tongue function as a chewing of food, swallowing of food, and organ of taste, and plays an important role in speech. Then papilla of tongue. There are 3 types of papilla: circumvallent papilla, fungiform papilla, and filiform papilla. In circumvallent papilla detects the taste is sour and bitter, and the filiform papilla detects the taste is sweet, and the filiform papilla detects the taste is salt. And here palatine tonsil. What is palatine tonsil? It means bundle of lymphatic tissue located in the lateral oropharynx. And lingual tonsil. What is lingual tonsil? It located at the base of the tongue. And foliate papilla. Last one, foliate papilla. Foliate papilla. What is foliate papilla? A rough surface on the side of tongue. That is foliate papilla. Then the structure you saw in the screen, the taste bud of the structure. Then taste buds. The mouth contains around 10,000 taste buds, most of which are located on and around the tiny worms or your tongue. Every taste buds detects 5 primary tastes: sour, sweet, bitter, salty, and umami. Umami, like salt of certain acid, for example monosodium glutamate or MSG. Each of your taste buds contain 50 to 100 specialized receptor cells. Sticking out of every single one of these receptor cells is a tiny taste hair that checks out the food chemicals in your saliva. When these taste hairs are stimulated, they send nerve impulse to your brain. Each taste hair responds best to one of the 5 basic tastes. Then there are so many disorders of tongues. First is geographic tongue, then strawberry tongue, then Enchiloglossia tongue, hairy tongue, and SCC tongue. So first we discuss about Geographic Tongue. So, geographic tongue. What is geographic tongue, and what is the condition, and what is the symptom? So, there are several terms I discuss. So, first, geographic tongue. It is also known as being migratory glottis, or it is a common disease. In this condition that causes harmless tongue patches and resembling smooth, and it located in dorsal part of the tongue. And symptom includes smooth red patches on the top or side of the tongue. The patches may changes location and size and shape. Then the strawberry tongue. It is a very common disease, and it is also called swollen bumpy tongue. And in this condition, the enlarged tongue is very red, like a strawberry or raspberry. The tongue will be white or few days before turning the red. Symptom of strawberry tongue: high fever, peeling skin, rashes, red and goofing eyes. There are the symptoms of strawberry tongue. Then the third one is Enchiloglossia. It is a very common disease. It is a very common disease, and it is also called tongue tie. In this condition that restrict the tongue range of motion, and symptoms of Enchiloglossia: difficulty sticking out of the tongue. Next we move on to hairy tongue. It is a rare disease, and it is also called lingua villosa and lingua nigra. Then location of hairy tongue: accumulation of excess of keratin and abnormal coating on the top or dorsal surface of the tongue. It is a harmless condition. It caused by a build-up of dead skin cells on the tiny projection, and that contains taste buds. Then symptoms of hairy tongue: discoloration of the tongue, bad breath and metallic taste in the mouth. Then the last one is SCC of tongue. It is a very common disease, and SCC full form squamous cell carcinoma, and it is a common type of tongue cancer, and it is called squamous cell carcinoma. It located in the lateral border of the tongue. In this condition, smoking, alcohol abuse and risk factor for SCC of tongue. Then symptoms of tongue cancer: there are several symptoms in tongue cancer. A red or white patches on the tongue that will not go away, and sore throat, pain when swelling, and numbness in the mouth, pain in the ear, and unexplained bleeding from the tongue that is not caused by the biting your tongue or other injury. So, thank you to all for listening to my presentation, and I hope all are enjoy in this topic. Thank you.